This is Dudley Harris speaking, and we're going to just review refraction with the phoropter. The first thing to do is zero out the phoropter. So it's 0 in the sphere, 0 in the cylinder, the same thing over there. And make sure that these levers are set in the out position because you're testing for distance. Then you put the phoropter in front of the patient. You check the PD. By adjusting that, you look through here to make sure the two eyes are lined up, and you do the PD adjustment there. You do the leveling with this knob here, and once you have the patient's eyes in the proper position, then you adjust the head with this position, with this knob here, the position of the head. And you can take a pen light and hold it right here and shine it that way, and then you can see where the eyes are. Sometimes it's hard to see. So leave the room lights on for that adjustment. Then you turn the room lights off, but make sure that you have enough light so that you can see your dials. Now, what you do is you enter the autorefractor results. So I'm going to say that the autorefraction said this patient was -1, -1, axis 180. And let's say the other eye was plano. So the patient is in position, the autorefraction is dialed in. Now I want to make sure the patient can see the screen at the end of the room. So I say, can you see the letters at the end of the room? And you might put up, say, the big E or whatever. Put up the big E. Can you see the screen at the end of the room or the letter? And you don't say the big E because then they say, oh my God, I can't see the big E, I must be blind. So just say, can you see the screen at the end of the room? They say yes. Okay, so you're lined up. Okay, now you close the left eye, and we're going to refract the right eye. So the first thing you do is put up the 20/40 line. And let's say you have no reason to think that this patient is not normal. So you can you're going to refract off the 20/40 line. If they can't see 20/40, then that's something different. But let's assume this is a normal person. Because you have the 20/40 line up there. And so you say, read those letters as best you can. And they say, FCBD4. You say, okay, that's good. Now, is it easier to read like this number 1 or this number 2? They say number 2. And so you say easier 3 or easier 4. And they say 3. So you go put it back to 3. So then you say, is it easier to read number 5 or number 6 or about the same? You know that it's going to be about the same because the autorefractor is so accurate that this is about their right prescription. So that's so suggest to the patient that it might be about the same, and this will give them the idea, well, it's about the same. So don't force them to make a choice when it's so difficult. At the end point, they look about the same and the patient can't tell the difference. So suggest that they might be about the same. Okay, so let's say the patient likes that. Okay, so there you are with the sphere. Now we're going to do the cylinder. So we put the Jackson cross cylinder down, and we always start by checking the axis of the cylinder first. So here is the axis that we've dialed in, and so we put the cross cylinder down, and we use these dots, and we straddle that line. Or another way of saying is line up the axis with the knurled rings here. Never touch this dial unless you have the Jackson cross cylinder in place. Always give the patient a choice with the cross cylinder. You never fine-tune by just changing the cylinder with this dial. That is, with like this, or trying to fine-tune it, that's a waste of time. Do not do that. Because with the cross cylinder, it makes the difference between a quarter of a diopter here look like a half a diopter, so the patient has a much better ability to make that distinction. So, again, never touch this knob unless the Jackson cross cylinder is in place. So now we're going to do the axis of the cylinder. So we have the axis is straddled by the dots. Okay, better 1 or better 2. He says 2. Okay, so 2 is this position right here. if you said better 1 or better 2, and the patient said better 1, then put 1 back up. This is what the patient wants. Now then, you're always following the red. Okay, so here's your axis, there's the red, you're going to go that way. So you turn the dial that way. Well, let's say 5 or 10 degrees. Okay, better 3 or better 4. And if the patient doesn't answer, do it again. 3 or 4, or about the same. So let's say they say 3. Okay, you put 3 and you go back this way. So now the patient's gone this way, now a little bit back. So now you know it's probably about the same. So this time you're really going to suggest it. So say better 5 or better 6 or about the same. They say it's about the same. Okay, good. You've got the axis. Now you line up the dots with the axis. Okay, better 3 or better 4. They say 4. Okay, so this is what they wanted. It's red is on the axis line, so you want to add red or add minus. So you give them another quarter of minus. So you say better 5 or better 6. And they say 6. So they want another quarter of minus. Add another quarter of minus. Better 7 or better 8. They say 7. So that now they didn't want that actually. So you go back. You take off a quarter of minus because they wanted white, which is plus, and to go plus, you take away a quarter of minus. Okay, now you know that you're about there. So you say better 1 or better 2 or about the same. So this time they're going to say, yeah, it's about the same. Okay, you are finished with the cylinder. Now then, you put up, now you say the 2040 line is up there, so just to check, you say read that line as best you can. So they say FCBD4, you say fine. So then they read that so quickly that don't bother with the 2030 line, just go to 2025. Okay, FCBD P or whatever. And then, so they read that line, now put up 2020. Okay, whatever 2020. So they read 2020. Okay, OFLC3. No, that's the 2030. Okay, so they read 2020. So they read 2020 with this prescription. Now, are you guaranteed that this is the correct prescription? No. You've got to do one more thing, and that is to see if they will take any more plus. So you add a half a diopter of plus, and you say, does that blur it just a little bit? And they'll say usually yes. Okay, so you take that out. Now you know that is a correct prescription. Now if you say, does this blur it a little bit? You add a half a plus. And they say, no, that's still clear. Okay, give it to them. Now do that, add another half. Does that blur it a little bit? And this time they're going to say, yes, that does blur it. So take that out. You always want to give them as much plus power as you can. You crowd the plus. Now on the cylinder side, when you're working on the cylinder power, you always want to give them as little power as you can, because the stronger you make the cylinder add, the harder it is to get used to the glasses. I mean, it's not a big deal because a quarter is not going to make that much difference, but at least you want to go in the direction of using less minus in the cylinder, and you want to go in the direction of using the most plus in the sphere. Okay, now you are finished with that right eye. It is done. Now we're going to do this eye. Here they have, now what you do, now you go over and open the left eye, and then you close the right. Do it in that order so you don't leave them in the dark. Okay, so now you've got the left eye open, and they have asked for plano. So we're going to do, so you say, read that line as best you can, FCBD4. Okay, good. Is it easier like this number 1 or this number 2? They say number 2. Okay, so that means that's good so far. And they say, is it easier like this number 3 or this number 4? And they say number 4. Okay, so that's still plano. So you're finished with the sphere. But now then, you've got nothing in the cylinder. How can you check to see if they actually would like some cylinder? Well, here's the way. You dial in a half a diopter of cylinder. Now, here's the one exception for doing something without the Jackson cross cylinder in there. You just start rotating the axis of the cylinder. And you say, now just watch those letters, and I'm going to blur those letters a little bit. I want you to tell me when the letters seem to sharpen up. Just say stop when those letters get the sharpest. So you rotate it at about this rate, and you say, just watch those letters, and just tell me when it gets the sharpest, just say stop when it gets the sharpest, and they'll say stop. Okay, so 180. So that's not a bad guess. The other eye was 180, so that's probably about right. Okay, now let's see if they actually want that. Okay, so we're going to check the axis of the cylinder. So we put down the Jackson cross cylinder. We straddle the axis with the dots. Okay, is it easier to read like this number 1 or this number 2? They say they're about the same. Okay, so the axis is correct. Now we're going to check the power. So we're going to line up the dots along the axis that we have dialed in. Okay, better 1 or better 2? They say 1. So you set it to what they liked. They wanted this, which is white, which is plus. So you take out a quarter. Okay, I mean you take out a quarter of minus power. All right, is it better or easier to read like this number 3 or this number 4? And they say 3. Okay, so again, they wanted less power, so you take out a quarter of cylinder. Now you've got Plano again. Okay, so now you're confident that they really don't need any cylinder. So you take the Jackson cross cylinder out, Plano, and okay, so now then you say, read those letters as best you can, FCBD4. So then you put up the 2025 line. Okay, they read that line. You put up the 2020 line. They read that line. So now you say, does that blur it just a little bit? And you add a half a plus, and they say, yes, it blurs it. So you take that out. Okay, that is the prescription. You're finished. And that is Plano. So that's just what they ask for, but that's how you check. You cannot assume that just because they can see 20/20 with the auto refraction and it's Plano, that's their prescription. You still have to check. You've got to check the sphere, and you can also check the cylinder just like I showed you just now. After you've gotten this, then you are finished, and you can take the 4-opter away. You do not have to check both eyes together. You do not have to check for near. Theoretically, we could check for near, and sometimes that may be appropriate, and I'm sure Dr. Erdmanchek would want to do that occasionally, but for me, I don't like to use that time because I don't think it's productive, because I think that the power of the ad is so clearly related to age, and there's so few choices that you're not going to be off. And anyway, so you write down what you think the ad ought to be. Dr. Erdmanchek's going to give you a sheet that will explain how to do that. And then it's the doctor's responsibility to look at the prescription and decide what ad that is that the doctor wants to give. So usually if a person is farsighted, you give a little more ad. If they're nearsighted, you give a little bit less. If they see 20/20, you don't want to give anything greater than 2 1/4. Because that gives them enough working range, and that's enough ad to see up close if they're 20/20, even if they're 65 or older. Now, if they're 70 or older, I probably would give 2 1/2 if they're 20/20. If they're less than 20/20, then I may go up to 3. But when you get to say 4 ad, then you're giving them such a short working distance that you better really think about that before you give them like a 4. Okay.